welcome. This is Jackie and Renee here with Shift Physical Therapy and Wellness, and you have stumbled upon, or maybe you've been here before, part of our site where we like to talk about all topics that are maybe challenging to talk about, or just ones that we want to be completely candid about and not censored to talk about. And today's topic is going to be about peeing ourselves. It happens.
So this is definitely a topic that gets a lot of joking around with our friends that, oh, I laugh or I sneeze and then I pee myself, or I don't jump on the trampoline with the kids anymore because I pee myself. And everybody kind of jokes with their friends about it, yet they don't talk to their doctors or talk to a pelvic floor physical therapist about these issues that can actually be fixed. So here we are today to talk about the different types of incontinence and who it affects, and just a little bit more about that.
So a lot of times throwing around the word incontinence, people kind of get a different idea of what incontinence means. And a lot of people think that maybe it's only for our elderly population that experience incontinence, or it's like if you have a large amount of urine that you leaked or feces that you leaked. Today we're talking more specifically about urinary leakage, but there is fecal incontinence as well. Incontinence of any sort, small amounts, large amounts, is not normal. It might be common, but it is not normal, and we can help you.
Yeah, and I think it's also important, like Jackie was talking about, a lot of people think this only happens to older folks. We actually see this happening in women who haven't had babies, especially even teenagers, teenage athletes particularly, ones in high impact sports. And I think it's important that we open up this conversation and normalize the conversation, because there's a large percentage of women who are experiencing this on a regular basis and are embarrassed to talk about it with their coaches, their parents, their providers. So when folks come to us and are experiencing leakage, if it's stress urinary leakage, which maybe a better term for that is exertional or activity related, because it's again coughing, sneezing, laughing, jumping, running, those higher impact things that typically lead to the leakage. But the important thing is when somebody comes to us with those types of symptoms, it's not always just strengthening that needs to happen. Right. So people think, oh, it's because I've got weak pelvic floor muscles. Maybe. But it's really important to have a pelvic floor physical therapist do a full examination and evaluation of your symptoms, because that might not be just what you need. Some people can have tightness of pelvic floor muscles that are making it impossible to stop that flow of urine. Yeah. So it's really important at that point to seek out a professional to help you with your symptoms.
All right, so a couple different types of incontinence. Renee already touched on stress incontinence, or this happens with activity. It maybe happens with exercise, or you're jumping on a trampoline, or you sneeze or cough, and whoops, you leak a little bit. So that's one type of incontinence. Another type that we see is urge incontinence. And this happens a lot of, like, maybe you are pulling into your driveway and all of a sudden, I gotta pee. Or you put that key into the lock to turn to go into the door, and I gotta go now. This has gotta go. So those are two different types of incontinence, most frequently that we see. And then you can have both types of incontinence or mixed incontinence. It's important to know that there are some things that you can already be doing today to help with some of those symptoms. And one of the things that we always talk about is the JIC, or the just in case. Try to avoid going to the bathroom just in case something comes up. Our bladder is meant to hold that, and we start to train our bladder very, very differently than what it's meant to do when we do the JIC.
Yeah, if you're using the bathroom every time before you leave the house, and maybe your bladder isn't really full, but you're like, I might be in the car for more than 10 minutes, and what if I have to go? Going to the bathroom when our bladder isn't completely full can actually lead to kind of missed signals with our brain and create some of that urge type incontinence. And so it's really important that we eliminate that just in case. Or maybe you've started out with having some stress urinary incontinence or that activity incontinence. So you're gonna go out for a run and you decide, well, I should use the bathroom just in case. But again, maybe your bladder wasn't really full And now what started as a stress incontinence or an activity-related incontinence issue has now started to become an urge incontinence as well.
One of the things with incontinence too that kind of fires me up a little bit is a lot of times women who have had pregnancies or had multiple pregnancies do experience this leakage, and we go to our 6-month or 6-week follow-up and it's not discussed. We're talking about how is breastfeeding going, or are you having any discomfort, are you able to get back to activities, this, that, and the other, but we never actually get asked, are you having urinary leakage? So I would encourage you to go ahead and start opening that conversation up with your physician and get that taken care of sooner rather than later. Because again, we talk about this, it's not normal. It happens, it may be common, but it's not normal. And what are some things that you can expect from us coming into physical therapy if you are experiencing some of that urinary leakage and peeing yourself? So upon initial evaluation, Renee is the guru. She'll help you.
One of the first things we're probably going to do is called a bladder diary, where I'm going to send you home for 2 days. You're going to be
a bit of homework.
Going to be doing a little homework and just tracking a few things for us, and that's going to help provide some information at our follow-up visit about what exactly are the main issues that we're dealing with for your case. Also during that evaluation, we're going to look at everything from a very external perspective in terms of your strength and your flexibility, maybe just some of your habits. We're going to be talking about how long this has been an issue for you. And then if on that first day that we decide it is important to do an internal assessment, we would talk through exactly what that looks like and if that's appropriate for you at that time.
And we go all in with even that bladder diary. We're going to be looking at some of the food and fluid intake, because there might be something that you're consuming that's actually creating bladder irritation that's causing some of these symptoms. So some of those, maybe you're not taking in enough water, or maybe it's a certain food that can irritate the bladder or something. So we look at it, all the things, and help design a plan that's going to get you feeling better, having less leakage symptoms. And a lot of times our women notice an improvement in their symptoms within the first couple visits. Right. So this is something that we can definitely help you with. You're not alone. Don't be embarrassed to talk about it. I know a lot of women come in here and it's like, well, I'm worried about the odor. It's fine. We'll walk you through it. We'll take care of you. We got you. So if you're experiencing urinary leakage, just know it is common but not normal, that we're here to help, and maybe even start opening the conversations to some of your young athletes as well and see if they're experiencing it so that they can have an outlet early on.